Have you ever paused to consider the global impact of diabetes, especially in low and middle-income countries? Diabetes mellitus, a serious metabolic disease, is a silent epidemic that is spread across all corners of the globe, affecting people regardless of geographic, ethnic, or racial origin. Its prevalence is increasing at an alarming rate, and the burden it places on our society, particularly on low and middle-income countries, is staggering. The impacts of modernization and urbanization have brought about marked adverse changes in lifestyle parameters. These changes, coupled with genetic predispositions, have led to a surge in diabetes cases. In 2013, the estimated number of people with diabetes globally was a staggering 382 million. More than 80% of these individuals resided in low and middle-income countries. India, for instance, had 65.1 million adults with diabetes in 2013, ranking second among the top 10 countries with the largest number of diabetes cases. This number is predicted to rise to a shocking 109 million by 2035 if preventative measures are not taken. Primary prevention of diabetes is indeed feasible. Strategies such as lifestyle modifications have been shown to be effective in populations of various ethnicities. However, for these strategies to be implemented at the population level, culturally and socially acceptable national programs need to be formulated. Unfortunately, such programs are currently lacking in most of the developed and developing countries. Early diagnosis and institution of appropriate therapeutic measures yield the desired glycemic outcomes and prevent vascular complications. The most common type of diabetes, type 2, accounts for 85 to 95% of all diabetes cases. It often remains undiagnosed for several years due to its latent, asymptomatic period of subclinical stages. With such a significant global impact, understanding diabetes becomes critical for everyone, regardless of where they live. So, what exactly puts you at risk for diabetes? Well, there are several factors that can increase the likelihood of developing this metabolic disease. One of the major risk factors is a positive family history of diabetes. If you have immediate family members with diabetes, you may have a higher risk of developing the condition. Age also plays a significant role. Once you're over 35, your risk of developing diabetes increases. It's a good reminder to have regular checkups as we age and ensure we're keeping an eye on our health. Another important risk factor is your body mass index, or BMI. Being overweight with a BMI of 23 or above, or obese with a BMI of 25 or above, increases your risk of diabetes. This is because excess fat can affect your body's ability to use insulin properly, which can lead to diabetes. The size of your waist can also be a risk factor. For men, a waist size of over 90 centimeters, and for women, over 80 centimeters, can be a sign of risk. This is because excess fat in the abdominal area is associated with insulin resistance. Your lifestyle can also put you at risk. A sedentary lifestyle with little to no physical activity can increase the risk of diabetes. Regular exercise helps control your weight, uses up glucose as energy, and makes your cells more responsive to insulin. Another risk factor is hypertension or high blood pressure. High blood pressure can often coexist with high blood sugar levels, and the two conditions share some similar causes and risk factors. Recent weight gain and a history of gestational diabetes during pregnancy can also increase your risk. These risk factors can be easily identified through simple, non-invasive risk scores. It's important to know them and discuss them with your healthcare provider. Being aware of these risk factors is the first step towards prevention and early diagnosis. If you can identify and manage these risk factors, you're taking significant strides towards reducing your risk of diabetes. But what if I told you diabetes often progresses silently, with symptoms appearing only in the later stages? It's a chilling thought, isn't it? But this is the reality of type 2 diabetes, a condition that accounts for 85 to 95% of all diabetes cases. Type 2 diabetes has a latent, asymptomatic period of subclinical stages. In common parlance, this means it often remains undiagnosed for several years. It's like a clandestine intruder, quietly wreaking havoc without you even knowing it. As a result, in many patients, the vascular complications are already present by the time diabetes is finally diagnosed. This diagnosis often comes as a result of opportunistic testing, rather than symptoms prompting a checkup. Let's consider the Asian population, particularly Asian Indians. They have a higher risk of developing diabetes at a younger age compared to their Western counterparts. This means that the silent progression of the disease can start early, leading to long-term sufferings and societal burdens. The silent progression of this disease is insidious. Why? Because the signs and symptoms of diabetes are often disregarded due to the chronic progression of the disease. People do not consider this as a serious problem because, unlike many other diseases, the consequences of hyperglycemia are not manifested immediately. Damage can start several years before symptoms become noticeable. This is unfortunate and dangerous, as early recognition of symptoms could potentially prevent or delay the onset of complications. Imagine a dripping faucet, the water droplets representing the gradual damage done by this disease. Each droplet, seemingly insignificant on its own, contributes to a larger, more destructive force over time. This is the silent progression of diabetes, an insidious process that highlights the importance of awareness, early detection, and proactive healthcare measures. So, while diabetes may be a silent intruder, we can combat it with knowledge and vigilance. Regular checkups, lifestyle modifications, and a keen awareness of one's body can serve as our defense against this silent adversary. The silent progression of diabetes underscores the importance of regular checkups and early diagnosis. So how can you tell if you or someone you know might have diabetes? Knowing the signs and symptoms is crucial because they are often overlooked due to the chronic progression of the disease. First off, frequent urination could be a sign. If you find yourself visiting the bathroom more often than usual, especially at night, it may be a symptom of diabetes. This happens because your kidneys are working overtime to get rid of the excess sugar in your blood. Secondly, you might notice that you're feeling more thirsty than usual. This is your body's way of trying to replenish the fluids lost through frequent urination. Another common sign is feeling overly tired or fatigued. This happens because your body's cells aren't getting the glucose they need for energy. So, even if you're eating enough and getting plenty of sleep, you might still find yourself feeling drained. Unexplained weight loss is another symptom to watch out for. If you're losing weight without trying, it could be because your body is using alternative energy sources, like fats and proteins, since it's not able to use the glucose in your blood. You might also experience blurred vision. High levels of blood sugar can cause the lenses in your eyes to swell, altering your ability to see clearly. Other symptoms include slow healing sores or frequent infections, tingling or numbness in the hands or feet, and patches of dark skin, usually in the armpits and neck. Remember, these symptoms can be subtle and easy to overlook. They often develop gradually, making it easy to get used to them or write them off as signs of aging or stress. But they are not normal, and they shouldn't be ignored. One thing to note is that these symptoms can vary from person to person, and not everyone with diabetes will have all of these symptoms. That's why it's important to get regular checkups and communicate any changes in your health to your doctor. Recognizing these signs and symptoms can help catch diabetes early and mitigate its long-term consequences. So what can we do to tackle this global health issue? It begins with you. Yes, you. Each one of us has a role to play in the fight against diabetes. It starts with awareness and understanding the importance of regular checkups. You see, diabetes often goes undiagnosed for years because its progression is silent, and its symptoms are not immediately noticeable. Regular health checkups, especially if you fall into any of the risk categories, are therefore essential. They enable early detection, which is key in preventing the disease from advancing to its more serious stages. If you notice any signs of diabetes such as increased thirst, frequent urination, unexplained weight loss, or constant fatigue, don't ignore them. Schedule a visit to your healthcare provider immediately. But what if you find yourself at risk? Maybe you have a positive family history, you're over 35, overweight, or have a sedentary lifestyle. Should you resign yourself to the inevitability of the disease? Absolutely not. Preventive measures are not only possible but are also proven to be effective. Lifestyle modifications are at the forefront of these measures. Simple changes to your daily routine can make a significant difference. Incorporate regular exercise into your schedule. Make healthy food choices and maintain a balanced diet. Limit your intake of processed sugars and unhealthy fats. If you smoke, consider quitting. If you are overweight, work towards achieving a healthy weight. Early therapeutic measures are equally important. If diagnosed with diabetes, adhere to your treatment plan. Take your medications as prescribed and follow your doctor's advice regarding diet and exercise. Regular monitoring of your blood sugar levels is crucial. Remember, combating diabetes is not just about treating the disease. It's about preventing it from taking hold in the first place. It's about making conscious choices every day for the benefit of your health. Remember, early detection and prevention are the best strategies to combat diabetes. Stay informed, stay healthy. The battle against diabetes begins with you. Are you ready to take up the fight?